Hi guys, it's Student Nurse Tiff, and I'm just coming through with a video. I know it's been a minute since I last post, but as you guys know, nursing school does get kicked up, and sometimes I just get a little busy. So I just wanted to come through and just talk to you guys about the contents that's in my nursing lab bag. So basically, you need these contents for each time you go to lab, and the lab is necessary to practice certain skill sets that you will be using in a clinical setting. You practice these skill sets on either your peers or a dummy. And basically, the purpose of it is to get you into the proper way to do the technique of the skill, and also to be comfortable with doing the skill so that when you actually encounter a patient, you're not super nervous because it's your first time doing it, and you also have a familiar basis on how to do it and can possibly do it independently. So without further ado, let's go over the contents that's in my lab bag. So this is the lab bag. This is how it looks. It's fairly lightweight, and it has a lot of goodies in it. So let's see what's in here. So this is a blood pressure cuff. I actually had purchased one already off Amazon because I like cute things. So my particular blood pressure cuff that I have is pink, and I may use this like as a backup if I lose it or break it or something to that effect. Then it's always good to have more than one. Here we have a Foley catheter tray. And inside the Foley catheter tray, it comes with the actual catheter. It comes with a drainage bag, gloves, lubricating jelly, iodine swabs, a 10 milliliter syringe, drape specimen container, and another tray to keep everything in. So something like this, if you see it in a hospital, it would be considered a sterile thing. So it should never be open, and it should never be used, or content should be missing. If you notice that any of the contents are missing or it appears to be open, then you need to discard it and get a new one. I opened it because we did use this in lab already, so I would never use this in an actual clinical setting. And I won't reopen it because it is a lot of things in here, and I just don't want to go through the hassle of putting it all back together. But basically, this is a Foley catheter tray. And this here is a wound care tray. So in the wound care tray, it comes with a poly bag with a twist tie, a drape, dressing, tape, gauze rolls, more gauze, labels, a sterile saline, a measuring guide, and vinyl gloves. So your wound care tray would be for like your bed sores and things like that. You will want to basically make sure this is also never opened or used, because we don't want to introduce, any pathogens to our patients. We don't want to expose them. So want to make sure this is fully closed before we use this as well. Then we have a tracheostomy care tray, and it doesn't tell me specifically what's in here, but of course you will only use this for a single use. It also should be closed, never open. We haven't practiced this in lab yet, so I won't open it here, but this is what it looks like. And then we have the dressing change tray as well. So this is what you would use to change a dressing on a patient, and it comes with alcohol swabs, antiseptic applicator, a cotton tip applicator, dressing, and more gauze. It comes with gloves, mask, skin wipe, and tape. All in here. This also should be closed and never open. Anytime something is closed, we want to make sure that it remains closed because it's sterile. And here we have isolation gown for our patient. You've probably seen these before on TV or something like that, or had a family member on isolation. It comes with the little foot guards to protect our feet. We have also the head thing to cover our head, We have gloves, and we also have the mask for any, and then you'll use this on anybody, for anybody who's on isolation. You know, you want to make sure that you're geared up and you're protecting yourself, and you're also protecting that patient. So this is good to have because you also want to practice the order, because it's a specific order in which you have to put it on, and it's also a specific order how you have to take it off. So just having that to be able to practice on is cool. In a real setting, you will only use this stuff once. And we also have some sterile gloves here. Sterile gloves is a specific order on how you put these on as well, because you don't want to get them contaminated. If you put them on the wrong way, then they will be considered contaminated and you have to re-put them on. Then we have a caliper. I don't know what I would have to use this for. Probably have to do some research on that. But we'll see, we'll find out. We have this little tool for percussions. You've probably seen this before when you got a physical examination. The doctor may have tapped your knee to see if your knee will reflex once they hit it with this. So that's good to have when physical assessments are in need. We also have some scissors here. This is some measuring tape. I'm sure it will be useful as well. And we also have a tuning fork. A tuning fork is also necessary in a physical assessment as well. So it's good to have a tuning fork. And then I have a pen light. And you probably seen a pen light before as well when you were at the eye doctor or something like that, and the doctor will look at your pupils with a pen light. So I probably need a battery in mine because it doesn't seem to be lighting up. But yeah, that's the pen light. So it looks like I showed you guys all of the things that are in my lab bag. This lab bag cost me $100. Do I think that that lab bag was worth it for $100? Hell no. But hey, it will prove to be very useful in all the things that I will be doing in lab and all the things I will be doing in clinical. So if you look at it in that regard, I guess it is worth it. So that's it, guys. That's all the contents that are in my nursing lab bag. If you have any content that you would like me to go over, please comment below or feel free to email me. And if you're new to this channel and you like what you hear so far, please subscribe. And if you're a returning subscriber, see you guys next time.